Unconscious animals and severely depressed animals are the first emergency situation we'll discuss. This can be a confusing situation as there are many conditions that might cause an animal to be found unconscious or very depressed. The possible causes range from head injuries to severe anemia. Many illnesses and conditions can manifest themselves in this state, especially when the patient is in late stages of a disease. Unless the person responding to the emergency has knowledge as to the cause of this reduced mental responsiveness, it is best to minimally manage these patients and transport them immediately. In most cases, first aid for the unconscious animal should be limited to keeping them warm and transporting them immediately. A muzzle should probably be avoided unless they are determined to be awake enough to be potentially dangerous. If they show evidence of possible trauma, move them carefully to a board. Pay attention to their breathing as this may be compromised along with their mental state. If the animal is not breathing, as determined by watching for chest movement, the caregiver may elect to start CPR. Never attempt CPR on a conscious animal. This option is not for everyone, but many concerned pet owners will want to do everything possible to save their pet, especially in the event that the unconscious animal is not breathing. Anyone finding an unconscious animal should first assess if the animal is breathing or not. If they are not breathing, ask the pet owner if they wish to attempt CPR. This should be discouraged on stray animals or pets with illnesses that may be contagious to people. If the owner of a previously healthy pet wishes to perform CPR, then the following step-by-step process should be described. With a dog or cat lying on the ground and with the head extended straight out in a normal position, the tongue should be pulled forward between the teeth, closing the mouth around it. Make a seal with one hand cupped around the nose. The CPR giver should then place their mouth up to the hand cupping the nose and blow into the nose so as to inflate the lungs fully. They should remove their mouth until the air leaves the lungs, then repeat the inflating process a second time. If the lungs will not inflate, they should carefully check the mouth and throat for a possible choking obstruction. If the unconscious pet does not start breathing and there is no evidence of a heartbeat felt on the chest just behind the elbow, then complete CPR should be initiated. With the animal lying on its right side against a firm surface, have the pet owner compress the chest and heart approximately once a second, as demonstrated here. A hand on either side of the chest will improve chest compressions on small dogs and cats. They should depress the chest approximately 1 inch with each compression. Large dogs will require the use of 2 hands working together, pressing straight down in order to adequately depress the chest 2 to 5 inches. After every 5 compressions, inflate the lungs once, as discussed previously. If 2 people are available to perform CPR, then one should do chest compressions while the other does the breathing. Continue this process and plan to transport immediately. If no one is available to drive while performing CPR, then have them just concentrate on driving the pet to the veterinary hospital and do not try to perform CPR simultaneously. CPR should be stopped if the pet starts breathing again. The next emergency situation we'll discuss, and a very common one at that, is the trauma case. By this, we are referring to dogs and cats that have been hit by cars, attacked by other animals, fallen from high places, or any number of things that might inflict blunt trauma or penetrating wounds, such as gunshot wounds. Trauma in general often creates one or more internal injuries which are not readily evident on first appearance of the animal. This may be quite misleading to the pet owner if the external injuries don't appear too significant. A dog may walk away from being hit by a car with only a few abrasions and yet may be bleeding to death internally from a ruptured spleen or a tear in the liver. Whenever severe trauma has taken place, the animal should be seen by a veterinarian to evaluate for other injuries that may not be as apparent. Trauma also may lead to a life-threatening condition called shock. Shock may be defined as the body's response to a traumatic event, causing significant changes in blood flow and oxygen to the internal organs. This circulatory collapse can lead the animal into a downward spiral, leading to death if not quickly addressed through medical attention. Early signs of shock include increased heart rate, low body temperature, and pale mucous membranes. These subtle symptoms may be difficult for owners to recognize, so they should be advised to seek veterinary attention when significant trauma has occurred. Because shock may not be evident initially, the pet owner should have a traumatized animal examined regardless of their appearance. A rapid loss of blood will also likely induce shock in an injured animal. First aid recommendations for traumatized animals should include the following. Control external bleeding, as will be discussed in the next chapter. Keep the animal warm with a blanket or thermal blanket. Assume the animal may bite and take appropriate preventative steps such as muzzling. Place the animal on a board or onto a makeshift stretcher if the animal is unable to rise. Be aware that broken bones are a very real possibility when dealing with trauma patients. Minimize excessive handling of these patients and transport immediately. Bleeding patients are the next condition we will address. This may overlap with the traumatized patient, or it may be unrelated to trauma. An animal may be bleeding as a result of a skin laceration, a torn toenail, or a puncture wound. Bleeding may also be occurring in subtler ways, for example, a bleeding nose or internal bleeding. Any wound that is bleeding profusely or continuing to bleed should receive immediate medical attention. First aid measures should definitely be instituted in these situations. Bleeding can be divided into two types: slow oozing blood from a vein or pulsating squirting blood from an artery. Most cuts and lacerations should be seen immediately by a veterinarian if it appears that bleeding may be significant or the patient may need stitches. A wound should be stitched up within the first 6 hours for optimal healing. First aid for bleeding involves applying pressure to stop the bleeding. Most bleeding wounds can be controlled if adequate direct pressure is exerted directly at the point of bleeding. Cover the bleeding wound with any number of clean items found around the home, such as washcloths, paper towels, or articles of clean clothing. If a first aid kit is available, gauze pads provide an absorbent cover for the bleeding wound. If latex gloves are available, they should be worn by the first aid caregiver. Apply sufficient pressure for several minutes to stop the bleeding. With small blood vessels, stopping the bleeding for several minutes will allow the blood to clot. If this is not sufficient to stop the flow of blood, it may be necessary to apply a light pressure wrap over the bleeding area. When attempting to stop the bleeding on one of the legs, roll gauze or duct tape can be used to hold gauze or a washcloth in place for an extended period of time. The pressure should be sufficient to control bleeding, yet not so tight as to obstruct blood flow to the distal portions of the leg. When attempting to control bleeding on the head or trunk of the animal, someone will likely need to apply continuous pressure to the area until the pet gets direct veterinary attention. As long as an artery is not cut or severed, several minutes of pressure or a light pressure wrap is usually sufficient to control the bleeding. When a major artery has been severed and the blood is pulsing from the cut, very firm pressure may be required to stop the bleeding. Such pressure can be applied on a limb by tightly wrapping gauze pads or its equivalent with duct tape. A very tight bandage will usually stop the bleeding, but it may also restrict the circulation to the distal portions of that limb. To help prevent the leg from swelling, the entire leg should be wrapped if there is adequate time. Maintaining moderate pressure from the toes up to the bleeding wound will likely prevent swelling from occurring.